Hi, step one. So we will be discussing impact of female age to your fertility and IVF. So that's step one out of 50 steps. Okay, so your age and you compete in terms of fertility. Your age doesn't really want you to get pregnant, and it has a negative impact to your fertility. So same thing happens when you're trying to conceive naturally or whether you are doing IVF. So first you need to understand your opponent, which is your age, and then develop different strategies to tackle your opponent and get a successful pregnancy. Okay, so I will be in this video, I will be explaining what are the negative impacts of age to your fertility in IVF and how you can overcome this. Okay, so age impacts your fertility negatively by affecting your two most important fertility units, which are eggs and your uterus. In terms of eggs, the age negatively impacts quantity as well as quality of your eggs. In terms of quantity, because you don't produce new eggs as you get older, you lose your egg reserve and you have a lesser number of high quality eggs for natural conception or IVF. In terms of how we know it, because AMH, for example, the marker of your egg reserve declines as you get older. Once your AMH hits 0, then after a few years you have a menopause. So in terms of quality, so age negatively impacts quality of your eggs by weakening the structures which are responsible for division of the chromosomes. Eggs normally contain 46 XX chromosomes before ovulation. During ovulation, those chromosomes should split right in the middle, and you should end up with 23 X chromosomes, which will merge with the 23 chromosomes of the sperm to make healthy baby, which is 46 chromosome baby. So because of age, the division may not happen as planned, which is right in the middle. Then you may end up with extra or less copies of the chromosomes. If you have an exact 23 copy of chromosome, that's considered healthy egg, which is called euploid egg. If you have an extra or less copy of chromosomes, they are called aneuploid eggs. They're abnormal and they cannot give you a healthy child, and they usually are the causes of failed IVF treatment. So for example, when you're at the age of 30, approximately 25% of your eggs are abnormal, and when you're at the age of 40, 50% of eggs are abnormal. For example, if you're trying to conceive naturally at the age of 40, so 6 months out of 12 months you produce abnormal eggs, and you have a 0 chance of having pregnancy. The same thing happens in IVF. Let us say if you produce 10 eggs at the age of 40, probably approximately 5 of those eggs will be normal. And also risk of miscarriage increases as you get older. Usually that's linked to the chromosomes of the eggs. And also negative impact of age to your uterus is there because of you are more likely to develop uterine diseases, which reduces your chance of implantation and increases your chance of miscarriages. For example, you are more likely to develop adenomyosis, endometriosis, endometrial polyp, or fibroids as you get older. So, for example, adenomyosis causes inflammation of the uterus, which causes repeated implantation failure, increases your chance of having miscarriages, ectopic pregnancies. Similarly, severe endometriosis reduces your chance of implantation and can increase your chance of miscarriages. Endometrial polyps and fibroids are more common as you get older, and they reduce your chance of implantation. Again, they cause miscarriages. So generally, when you're trying to conceive naturally, as you get older, your chance of conception goes down every year. So then also when you try to conceive with IVF, your chance of success reduces as you get older. Okay, so now we understood how age can negatively impact your fertility. Now we'll have to work out the strategies and tactics to overcome the problems age going to cause to your fertility. So when you're trying to conceive naturally or generally effect of your egg to your fertility, so essentially if you're not doing IVF, then you need to tackle age effect in following way. In terms of negative impact of egg quantity and quality, You can reduce by staying healthy with healthy diet, exercise, and treating all medical conditions. And also very importantly, you should not delay having kids if you can. So if you can't, then you should preserve your fertility by freezing your eggs or embryos. A negative impact of age to your fertility or your uterus, you can reduce by using progesterone pill or Mirena, because usually you develop conditions such as adenomyosis, endometriosis, endometrial polyp, and uterine fibrosis because of a negative impact of cyclical estradiol for many years. The progesterone reduces impact of estradiol, and this is why if you're not planning to get pregnant, if you want to preserve your fertility, then you should consider using Mirena or progesterone only pill to protect your uterus in the long term. In terms of IVF, so in terms of a quantity and quality, so first stay healthy during IVF treatment and do not delay your IVF treatment. Or you should optimize ovarian stimulation. By optimization of your ovarian stimulation, you can get more eggs and you can get better quality eggs. Optimization you can do by changing regime of ovarian stimulation, using different types of FSH drugs to find the right FSH for yourself, then changing FSH dose and changing the trigger drug and dose. In terms of optimization of your implantation, you should first treat these conditions like adenomyosis, endometriosis, endometrial polyp, and uterine fibroids, then do embryo transfer. If you detect these conditions during fresh IVF cycle, then you should freeze all the embryos. Then you need to treat these conditions surgically or medically. Some of them can be treated medically, and then do embryo transfer. That should give you optimal chance for implantation. In this video, we can see that age can impact your egg quantity and quality and uterus negatively. But understanding all negative impact of the age, you can develop strategies to overcome and achieve your dream of having a healthy child.